The message to wear a mask from our leaders and health experts has ramped up recently as outbreaks pop up and spikes are a concern around the country. Tonight we're hearing from an infectious disease specialist at Spectrum Health who says wearing a mask is one of the easiest things we can do to still get out of the house and fight against COVID-19.
For us to defeat this virus, we all have to work together.
Dr. Liam Sullivan is an infectious disease specialist for Spectrum Health. His message is simple.
And a mask is one way that we can get back to some sense of normalcy in our society.
But what about claims masks cut down on oxygen intake or can hurt your immune system?
It's completely false that wearing a mask limits the amount of oxygen you get into your lungs and causes a buildup of CO2 in your lungs. Neither one of those is the case. People who work in the operating room, nurses, surgery techs, and physicians, wear a mask all day long, every day at work. They've been doing this their entire careers. I don't see them passing out from CO2 narcosis or having problems due to lack of oxygen at all.
As for your immune system,
when you're out walking your dog in the neighborhood, you probably don't need to wear a mask because you're not going to be around anybody. You're going to easily be able to maintain distance and you're outdoors. And, in that situation, you're getting plenty of exposure to the outdoor air. Thus, your immune system is doing its job.
Earlier this week, a study published by researchers at Florida Atlantic University tested the effectiveness of masks, giving visual examples of how far droplets can spread in the air based on different or no barriers. 6 feet is recommended as social distancing, but the study found droplets can travel 8 feet or more if a person is not wearing a mask. That distance dropped dramatically to just 2.5 inches with a stitched, quilted cotton mask. Dr. Sullivan says if listening to science doesn't convey a mask's importance,
and the only way we can change it is try to get them to look at this from a human perspective and think about, okay, if you're next to somebody who has coronavirus and they're not wearing a mask, do you want them spraying their virus all over you? I mean, I think that's one thing people need to think about is put the shoe on the other foot and how they would feel about that and how they would feel about their loved ones getting exposed to this and potentially getting severely ill or dying from it. And there are ways to limit that from happening.
You can hear more from Dr. Sullivan, including why herd immunity is not an effective approach to COVID-19 inside this story at woodtv.com.